Understanding gabapentin, a commonly prescribed medication. Gabapentin is a medication used to treat various conditions. It is primarily prescribed for seizures and nerve pain. Gabapentin is known by brand names like Neurontin and Gralise. It is a popular choice for doctors and patients due to its perceived effectiveness and relatively low cost. Gabapentin works by affecting the way nerve signals travel in the brain. This action helps to reduce seizure activity and alleviate nerve pain. The exact mechanisms by which gabapentin exerts these effects are not fully understood. However, it is believed to involve the regulation of neurotransmitters. Gabapentin is available in various forms, including tablets, capsules, and oral solutions. The dosage of gabapentin varies depending on the individual patient and the condition being treated. Doctors typically start patients on a low dose and gradually increase it until the desired effect is achieved. It is important to note that gabapentin is a prescription medication. It should only be taken under the supervision of a healthcare professional. Self-treating with gabapentin or any other medication can be dangerous and lead to unintended health consequences. The rise of gabapentin increased prescription rates in recent years. In recent years, there has been a significant increase in the prescription rates of gabapentin. This medication, originally developed to treat epilepsy, has seen its use expand dramatically. This upward trend can be attributed to several factors, including changes in medical guidelines and evolving perceptions of the drug's utility. One reason is the expanding range of conditions for which gabapentin is prescribed. Initially approved for seizures and nerve pain, gabapentin is now frequently prescribed for other conditions. These conditions include anxiety, migraines, and restless leg syndrome. The versatility of gabapentin has made it a go-to option for many healthcare providers. Another contributing factor is the pharmaceutical industry's role in promoting gabapentin. Drug companies have heavily marketed gabapentin to healthcare professionals. They emphasize its potential benefits while downplaying its risks. This aggressive marketing strategy has undoubtedly influenced prescribing practices across the board. The influence of pharmaceutical marketing cannot be overstated. Many doctors receive samples and promotional materials that highlight the drug's positive aspects. Furthermore, the relatively low cost of gabapentin compared to some other medications has made it an attractive option for both patients and healthcare providers. In an era of rising healthcare costs, affordability is a significant factor. The affordability of gabapentin has likely contributed to its increased use. Patients are more likely to adhere to a medication regimen that doesn't break the bank. However, the rise in gabapentin prescriptions has raised concerns among some healthcare professionals. They argue that the drug is being overprescribed. These professionals believe that gabapentin is being used for conditions for which it has limited evidence of effectiveness. This overuse raises several concerns. Potential risks, side effects, and the development of dependence are significant issues. As gabapentin use continues to rise, these concerns become increasingly relevant. It's crucial for both healthcare providers and patients to weigh the benefits and risks carefully. Ongoing education and awareness are key to ensuring that gabapentin is used appropriately and effectively. Uses of gabapentin, from seizures to nerve pain. Gabapentin was initially approved by the Food and Drug Administration, FDA, for the treatment of seizures. This approval marked a significant milestone in the management of epilepsy, providing a new option for patients who struggled with uncontrolled seizures. It is classified as an anticonvulsant and is often used as an add-on therapy to other anti-seizure medications. This means that gabapentin is typically prescribed alongside other drugs to enhance its effectiveness and provide better seizure control. Gabapentin is effective in reducing the frequency and severity of partial seizures, which are characterized by abnormal electrical activity in a specific area of the brain. These partial seizures can manifest in various ways, including sudden jerking movements, sensory disturbances, or even brief periods of confusion. Another primary use of gabapentin is for the management of nerve pain, also known as neuropathic pain. This type of pain arises from damage or dysfunction in the nervous system and can be particularly challenging to treat. Nerve pain can result from various conditions, including diabetes, shingles, and spinal cord injuries. Each of these conditions can lead to significant discomfort and impact a person's quality of life. Gabapentin works by interfering with the transmission of pain signals from damaged nerves to the brain, thereby providing relief. This mechanism helps to alleviate the persistent and often debilitating pain associated with neuropathic conditions. Gabapentin is particularly effective in treating post-herpetic neuralgia, a painful condition that can occur after a shingles infection. Post-herpetic neuralgia can be extremely distressing, causing severe pain that can persist long after the initial shingles rash has healed. Shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. After a person recovers from chickenpox, the virus can remain dormant in the body and reactivate years later as shingles. Post-herpetic neuralgia can cause burning, stabbing, or shooting pain that can last for months or even years. This chronic pain can be difficult to manage and can significantly affect a person's daily activities and overall well-being. In addition to seizures and nerve pain, gabapentin is sometimes used to treat other neurological conditions. Its versatility makes it a valuable tool in the management of various disorders that affect the nervous system. For example, it has been found to be helpful in reducing the symptoms of restless leg syndrome, a condition characterized by an irresistible urge to move the legs, often accompanied by uncomfortable sensations. This condition can disrupt sleep and significantly impact a person's quality of life, making gabapentin a beneficial option for those affected. Section 4. Off-label use of gabapentin, a growing concern. While gabapentin is approved for specific medical conditions, it is increasingly prescribed off-label for other purposes. This trend is becoming more common as doctors seek alternative treatments for conditions that may not respond well to traditional therapies. Off-label use refers to the practice of prescribing a medication for a different reason than its FDA-approved use. This can include using the drug to treat conditions that it was not originally intended for, or prescribing it in a different dosage or form. While off-label prescribing is legal and sometimes medically necessary, it can also be a cause for concern. The lack of extensive research and FDA approval for these uses means that the safety and efficacy of the medication in these contexts are not fully understood. One of the most common off-label uses of gabapentin is for the treatment of anxiety disorders. Patients who do not respond well to traditional anti-anxiety medications may be prescribed gabapentin as an alternative. While some studies suggest that gabapentin may have some anxiolytic effects, there is limited evidence to support its long-term use for this purpose. The lack of comprehensive studies makes it difficult to fully understand the potential benefits and risks. Moreover, gabapentin is not without its risks, and its use for anxiety should be carefully considered. Patients should be fully informed about the potential side effects and the lack of long-term data supporting its use for anxiety. Another off-label use of gabapentin is for the management of chronic pain conditions such as fibromyalgia and back pain. These conditions often require long-term treatment, and patients may seek alternatives when other pain medications are not effective. While gabapentin may provide some pain relief in these cases, its long-term effectiveness is unclear. Patients and healthcare providers must weigh the potential benefits against the risks and uncertainties. Furthermore, the use of gabapentin for chronic pain is associated with an increased risk of dependence and withdrawal symptoms. Patients may develop a reliance on the medication, making it difficult to discontinue use without experiencing adverse effects. Off-label prescribing of gabapentin highlights the need for more research into its safety and efficacy for various conditions. Comprehensive studies are essential to provide clear guidelines and ensure patient safety. Patients should be aware of the potential risks and benefits of off-label use and discuss their options with their healthcare provider. Open communication and informed decision-making are crucial in managing their health effectively. Section 5. The dark side of gabapentin, potential risks and side effects. While gabapentin can be an effective medication for certain conditions, it is essential to be aware of its potential risks and side effects. Like all medications, gabapentin can cause adverse reactions, some of which can be serious. One of the most common side effects of gabapentin is drowsiness. This side effect is particularly pronounced when starting the medication or increasing the dosage. Other common side effects include dizziness, fatigue, and blurred vision. In some cases, gabapentin can cause more serious side effects such as allergic reactions, mood changes, and suicidal thoughts. If you experience any unusual or concerning symptoms while taking gabapentin, it is crucial to seek medical attention immediately. It is important to note that the risks and side effects of gabapentin can vary depending on the individual patient, the dosage, and the duration of treatment. Patients with pre-existing medical conditions, such as kidney or liver disease, may be more susceptible to adverse reactions. Section 6. Exploring the adverse effects, common and serious side effects. As mentioned earlier, drowsiness is one of the most frequently reported side effects of gabapentin. This side effect can interfere with daily activities such as driving or operating machinery. It is essential to avoid activities that require alertness until you know how gabapentin affects you. Dizziness is another common side effect that can increase the risk of falls, especially in older adults. Other less serious side effects include weight gain, swelling in the hands and feet, and dry mouth. While less common, serious side effects can occur with gabapentin use. These include allergic reactions, which can cause symptoms such as hives, itching, swelling, and difficulty breathing. In severe cases, allergic reactions can be life-threatening. Gabapentin can also affect mood and behavior. Some people may experience mood swings, irritability, agitation, or anxiety. In rare cases, gabapentin has been linked to suicidal thoughts and behaviors. It is important to remember that this is not an exhaustive list of all possible side effects. Patients should consult with their healthcare provider for a comprehensive list of potential adverse reactions and to report any unusual symptoms.